I've been anxiously waiting to see the results of TRED-HF because up until now, both patients and doctors didn't really know the importance of continuing medication in a heart failure patient with cardiomyopathy that had a weak heart, but then it recovered and went back to normal. Most patients, and in some specific examples, maybe they wanted to get pregnant and get off medication, but most of the time, patients don't want to take medication. So they're always looking for an opportunity to stop medication. Traditionally, heart failure specialists have said to their patient, you're going to take these drugs the rest of your life, but we didn't really have any evidence to inform that decision. So we saw today in a relatively small cohort of about 50 patients that the relapse rate was about 44% in as quick as 8 weeks when patients had medications taken away. So the message that has come to us, which I think is now reinforced, even from a small cohort, but a very, very carefully well done study, is you have to continue these medications for the lifetime of the patient.
This is a very important study, actually. The results will be very useful in determining the need for further investigation in heart failure, which is the subject population of this study. But the underlying principle is important for all areas of cardiology that are treated with pharmacologic therapy.
We can't predict who is going to be the 44%. We need better tools to be able to do that. But until we get to that point, the safest thing is to continue the medications. There will be isolated cases where we reduce medications, but the bottom line is that the main drugs, beta blockers, ACE inhibitors, angiotensin receptor blockers, have to be continued for the lifespan of the patient.
This was a pilot study. Pilot studies are designed to assess the feasibility of doing a big trial, a definitive trial. And so the sample size is so small that you could make a mistake in interpreting the data because of chance or some such. But here the results were pretty impressive. So even though it was just a pilot study, I think we learned a lot from it.